My name is Dr. Lara Salyer, and I love helping patients and physicians color outside the lines of what they think is possible in their health. What's eating you? Or should I say, what are you eating? We're always curious peering into everybody else's grocery cart, and especially being a functional medicine physician, the spotlight can feel a little heated. But I'm here to show you exactly what a Midwest functional doctor eats in a week. What do we have? We have leftovers from the night before, made lovingly by my husband. And in this is a dish that has a lot of broccoli, some rotisserie chicken, some rice, and a base of a dairy, looks like cream cheese or cheese blend. It looks like some onions as well. So I'm gonna go through each of these ingredients and then at the end tell you what I would give it as a health grade.
Broccoli is very healthy. It's a cruciferous vegetable. It is involved in phase 2 conjugation of your liver. What is that? That's the process that your body undergoes when it's trying to remove toxins, hormones, prescription medications, viruses, bacteria, all these things. It's also healthy because it has I3C, which is indole-3-carbinol, and that has cancer-fighting properties. So broccoli's great. However, the rest of this meal isn't ideal. The chicken is okay as well. It's the rice and the dairy. So rice can be quite detrimental to our insulin. As it's being digested, it's broken down into simple carbohydrates, and that can raise our insulin, and then we crash 3 hours later. And then dairy, of course, is delicious. I mean, I live in Wisconsin. Unfortunately, dairy can be very inflammatory, so I enjoy it in small amounts. And I abstain from eating dairy if I'm feeling sick, a little bit of a sniffle or a sore throat, because studies show that if you're sick or you have inflammation in your body, eating dairy will only make it worse. So if you skip, eating cheese or drinking milk on those times you're not feeling well, you can recover quicker from a virus.
What else do we have in here? Apple, which is quercetin. That's wonderful. Quercetin is an anti-inflammatory substance, really good for overall wellness and health. Apple a day keeps the doctor away, but maybe it attracts functional doctors. I'm not so sure. We'll have to research that. And then finally, my little treat is something I grabbed off the shelf. This is okay. It's not my favorite. It's quite expensive when you look at what's included in this package. It's basically designed to be a source of protein on the go. And these are balanced breaks. It has, again, some dairy, and it has a mixture of nuts and dried fruit. Now, I prefer almonds. They have a better omega-3 ratio. These are peanuts, which are high in omega-6 fatty acids, and those are more inflammatory. They can actually have your body produce more arachidonic acid. And then when you look at the dried cranberries, although tasty, it can actually also be more sugary in your body. And then again, we've got the dairy again. So I would say overall, this meal might get a 6. I wouldn't say it's my healthiest, but certainly not my worst. Hey, it's Dr. Lara back again for day 2 of my 5-day lunch challenge. So what does a functional doctor eat for lunch? Let's see what I have for today's pick. It's a treat for me. In here is albacore white tuna with just a little bit of mayo. Not good for those people that can't handle eggs. I can handle eggs, but I cannot handle gluten. So I never eat anything with bread or any other gluten products. Instead, I will be eating my tuna with cut up cucumbers and sugar snap peas. This is a great alternative. It's sort of like a chip and dip, and this provides high water content and great soluble fiber. Now remember, there's a lot of mercury in tuna, so this is a treat, especially if you're a pregnant mom or a young child. You should not be consuming a lot of tuna because of the high mercury. So I usually eat this maybe once a month in small quantities. And since I'll run out of that quickly, I made sure to pack extra hummus. Again, normally I like to make this myself, but I do like this brand. Hummus is great because chickpeas are a great source of fiber, and they help blunt that sugar insulin response after eating. So it's a nice way to keep everything normalized. You don't get that 3 p.m. crash. And then after I enjoy my main meal, I brought blueberries for dessert. Blueberries are a great source of flavonoids. They are the master antioxidant fruit. And why is oxidative stress such a big hot topic? Because we all have it. Marathon runners will have oxidative stress, but there's good and there's bad oxidative stress. So when you're dealing with inflammation or some kind of chronic illness, more oxidative stress can be damaging. Your body starts to make mistakes. You start to have more of a risk of cancer and inflammation and symptoms. So boosting your antioxidants in your body is the best, and blueberries are top. So I'd say I give myself an 8.5 on a scale of 10 on this lunch. I think it's a good way of having some high protein, healthy choices for vegetables and fruits. So let's see what I have tomorrow. So it's midweek, which means that I'm running out of groceries. I have a house of 3 kids, and with remote schooling in 2020, that means snack options are now minimal and we'll need to do another grocery run. So I had to be a little creative today and pick the items that never go touched by my children, which usually means healthier choices. And today it is a power bowl. Now normally I don't advocate microwaving your food, but if you know me, I am the 80-20 moderate physician that we have to make some amends. I love this because this is done not in plastic, but in paper, so everything is recyclable. You're not getting that plastic contamination when you do microwave your food. I also let it thaw a little bit so that I don't have the microwave as high or as long as needed. And so why I like this choice is it's gluten-free. It also has a lot of leafy green vegetables, which is great. Spinach, kale, broccoli. It has some chicken and no rice. It's riced cauliflower. So I feel like all I'm doing is eating vegetables and chicken. I have got dark chocolate covered, well, powdered cacao almonds. So as we talked earlier, almonds are my nut of choice when you look at all the different variables. They are great for omega-3s, and it gets that little treat of having some dark chocolate, which is a great antioxidant. And then what I'm going to do instead of water today, I am going to have my green tea. So I like the Rishi brand of green tea, and I'm going to enjoy this with some hot water. Green tea is so important. Studies show that 4 to 6 cups of green tea is excellent for lowering inflammation, for helping with oxidative stress, helping cognition, lower risk of Alzheimer's, all sorts of great stuff. And I know that I love coffee in the morning, but I'm making it a personal habit to try and augment my afternoon with green tea options as a great cancer-fighting, antioxidant, lower inflammation alternative. And it does come in caffeine-free form, so if that is something that you're sensitive to, you can also do the caffeine-free versions. So this is day 3. I would say I give myself maybe a 6 as far as a healthy grade, or a 7. I mean, let's be honest, you know, any kind of sweets can be kind of detrimental, and I don't really like microwaving food, so that gave me a couple points off, but the green tea is so powerful. So let's see what I come up with tomorrow. Stay tuned. It is day 4 of What Does a Functional Doctor Eat for Lunch? And for those that have been following along, I'm moderate in everything I do. I also don't really like vegetables as much as you would think, so I try to get an excuse anytime to throw good, yummy vegetables in my mix of meals. What do I have today? Today I have actually leftovers from a favorite restaurant in a neighboring city, and these are spring rolls wrapped in rice paper. I mean, really, that's all bread is like the medium to deliver the food into your mouth. And since I have to eat gluten-free, I always look for alternatives that can be some type of container for the goodness that's inside. And spring rolls are perfect because it puts all the yummy vegetables within this low-calorie rice paper. And we have avocado, we have cucumbers, we have carrots, and then the dressing is this really delicious carrot ginger dressing to dip it in. Ginger's great for gastrointestinal upset. It helps curb nausea. It helps with anti-inflammation. It's also just tasty. And my main meal is actually leftovers. It is gluten-free noodles with marinara sauce and chicken, labeled Mom. Because if you're in my family, we have to label our food or it's up for grabs. So my kids know this is mine, written by my lovely husband. And I also have a little mix of Parmesan and Romano cheese. I think that's it, right? Yeah. And then my water. So this is my meal, and this is way more than what I'll eat. I'll probably bring at least 60% home for dinner. So there's my Thursday meal. And tune in, there's only one more day of the 5-day lunch challenge week. All right, we made it. It is day 5 of the lunch challenge. What does a functional doctor eat? So today, let's look in my bag. We have grapes, something easy I can grab. I'm all about finger food and snacks. I know that we really should be eating more of a time-restricted feeding window. That is best. So I try not to eat my first meal until 10 in the morning. But then from that hour, from 10 until I'm done working, I love having lots of little things to grab. Grapes, other fruit that you've noticed, an apple, and it keeps me nice and full. Speaking of grabbing, I love granola. So this is another one of my favorites. I just like grabbing handfuls of this. Sometimes I keep a little spoon at my desk so I don't have to get my hands messy. This is a nice thing to keep in my drawer. Keeps me fueled all day. And then today, my main course is a salad. And my main protein in this salad is hard-boiled eggs. I love the eggs for choline. It's really good for mitochondrial health. I've got lots of leafy green vegetables, kale, spinach. I've got some tomatoes, some sliced up cucumbers, some sugar snap peas, and it's tossed in a lemon poppy seed dressing. Now, again, everything in moderation. This has been a great week. You've seen a variety of things, but the whole purpose of eating healthy is to fuel mitochondria. Mitochondria is what turns our lights on in our brain. It helps our muscles feel alive. And dare I say, it is the key to creativity. Without mitochondrial health, you are not going to be your most vibrant creative self. And as the creative doctor who specializes in stress reduction and burnout, I am on a mission to get everybody eating healthier and fueling their mitochondria like they should. So hopefully this little 5-day challenge gave you enough tips and ideas that you can incorporate some of these in your life and continue coloring outside the lines of what you think is possible.